I asked my staff, like, are there any terms not on my list that I should add? And one of my staff members, like, peanut head, which basically refers to the look when you have hollowing at your temples. So as you get older, I keep saying that over and over, but as you get older, you get this hollowing out of the the temples, and you look more skeletal. And some people refer to that as peanut head. I don't love that term because it doesn't sound very good. This is Medspa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. If you've ever wondered what the heck is an 11, a banana roll, or a gummy smile, you've come to the right place. Today, in part 1 of Medspa Terminology 101, Dr. Otto and I discuss all the weird Medspa terms used around Botox, wrinkles, and Botox treatments. There are so many jargony terms, we had to break this up into 2 episodes. Next week, we'll cover lots of other terms like pillow face, cherries, and exosomes. Stay with us and find out why Mr. Spock would approve. This is Dr. Kate Dee, and I'm back this week with Dr. Desiree Otto. Des, thanks so much for being back on the podcast.
Okay. Hey, Kate. Thanks for having me back.
Yeah, so for our audience members, Dr. Otto is the doctor who runs our location in Kirkland, Washington. And of course, I'm here in West Seattle. And today we're going to talk about basic med spa terminology. The idea for having this conversation today came from a college classmate of mine who was listening to the podcast, and she had questions about a couple of the words that we used. And I thought it'd be a really great topic to cover some of these quirky words that we tend to use. Some people will know a lot of these, and some of them will be brand new to you, I'm sure. So, Des, are you up for covering all the basic of Medspa Terminology 101?
Sounds perfect.
Awesome. Okay, I thought we'd start with Botox and then kind of talk all about like facial lines and stuff. So first of all, there are 5 different neurotoxins approved in the United States, and we tend to call them either Toxin or Botox. What are the terms you guys use over in Kirkland for the most part?
Well, I think we tend to use Botox to really mean all of the other toxins, or we'll say Toxin, but it's sort of like Kleenex or Q-tips that you use to mean a facial tissue or a cotton swab. It's people use Botox to mean all of the toxins typically.
Yeah, it's kind of become a generic term, even though it's a trademarked term for a very specific neurotoxin that's made by Allergan. So if you use Botox in advertising or whatever, you're supposed to have a trademark sign on it. But we do tend to use the word Botox, or many people do, to refer to all of them. So the other toxins that are available in the U.S. besides Botox are Disport, which is kind of our number one toxin that we use besides Botox. And then also Xeomin, Daxxi, which is short for daxxify, and Jeuveau. And you can just say Toxin for short, but they all kind of refer to the same thing. And in actuality, the active part of each of these is really identical. So in actuality, like they all kind of work exactly the same way. They just have different proteins attached to them, and they have a little bit of different action inside your body, meaning some last more than others and some act a little quicker than others, but basically they're all the same thing. So if you ever hear Toxin or Botox, that kind of is referring to any of the above. And some people just call it Tox.
Right. And a lot of people don't even know what kind of toxin they've received. I see a lot of patients who come in and they don't know. They get injected, and they don't necessarily care as long as it works.
Well, I would argue that you should care because they do last different amounts. So if you're paying for Botox, which is actually quite pricey, but you get, let's say, Xeomin, which for most people agree it doesn't last as long as Botox. But if you're paying Botox prices, then, maybe you're getting ripped off. But if you don't actually ask, you may not know that you're getting the thing that you're actually paying for. So one thing you can do is just ask to see the vial, or just look at the vial as they draw it up. Most people will draw up the toxin in front of you. Not always. Sometimes people will draw up ahead of time, and have a bunch that are just sort of ready to go so that they can go quicker. So how about these terms, the 11s? What are those?
Yes, so the 11s are lines that can develop they look like 11s in between the eyebrows. And some people,
so there's vertical lines when you make kind of a mean frowny face that are between your eyebrows. Sometimes people will just have a 1 instead of an 11. Every once in a while you'll see 3 lines, so it looks like 111. But so the official medical term for that location is the glabella, and there are 3 little muscles that make the 11s. But basically, when you say 11s, that's what that means. What about forehead lines? Because a lot of times people say, I want my forehead done, but then they point to their 11s. So what's the difference between those two?
Well, the forehead lines are horizontal. Well, they can be vertical and horizontal, but they're in the forehead above the brows, where the glabella is sort of between the brows. So when you furrow versus when you raise your eyebrows up, the forehead lines are created from elevating.
Yeah, and those are 2 separate areas, and you need to treat both in order for your forehead to look well. So you can try to treat the horizontal lines of your forehead, but if you don't treat the 11s, sometimes that looks a little funny. You can certainly treat the 11s without treating the forehead lines, but it's 2 separate areas. So to keep in mind, I want some in my forehead, that's a bigger deal than just the horizontal lines usually. What about crow's feet?
Crow's feet are the little lines that are created when you smile that are lateral to your eyes.
Right, so right to the side of the corner of your eye, you get those little, usually there's 3, don't you think? 3 little lines usually.
3, or some people a whole bunch. Some people
or some people a whole bunch. But right at the corner of your eyes. And then sometimes crow's feet can extend along the underside of your eye, just around the side of it. And we can treat all of those with Botox. When you start to talk about just the looser lines underneath your eyes, some people point to their eye bags, which usually refers to sort of some loose hangy skin under your eye. Sometimes that can be quite baggy. Those lines are not treatable with Botox. That doesn't work. So, but crow's feet, yes. And then some people point to the crow's feet lines, but then they extend way down their cheek. I don't know if you have seen a picture of Hugh Grant recently, but he's got lines all down his face. So they started his crow's feet, but they kind of cut way, way down.
And sort of the accordion lines are the lines in the cheek that when you smile kind of go on the lateral cheek.
Yeah, and he kind of has those too, right? So the crow's feet are treatable. So the little ones right around your eyes on the ends, on the sides, right? The lateral side that we say in medicine. Those are treatable with toxin. But accordion lines, that's a whole other thing. So since we got to accordion lines, let's define that. Yeah, so it kind of looks like an accordion. So a series of more sort of vertical, diagonal lines that cut across your cheeks that happen as you get older with smiling or just talking. Have you heard of the banana roll or jelly roll? Do you ever use that term?
I'm familiar with it. It's not something that I use a lot.
Yeah, I've seen other injectors refer to that. So sometimes people will have a very kind of small eye bag, lower eye, under eye bag that people can sometimes refer to as a jelly roll. I do think some people attempt to treat that with toxin, but I don't really personally think that works all that well. But that's what that refers to. What about bunny lines? Can you define bunny lines
Bunny
for our
lines
audience?
are, you know how bunnies crinkle up their little nose. So when you crinkle up your nose to smile, or even to sniff, maybe there are little lines on either side of your nose, up kind of close to the corners of your eyes.
Yeah, and those, not everybody has those, but when you do, they can be quite pronounced, very noticeable. And those are actually really easily treatable with Toxin. What about smoker's lines?
So smoker's lines are the little fine lines that you get around your upper and lower lips when you purse your lips to draw out of a straw or to smoke. Hopefully no one's smoking.
Right. We all encourage you all to not smoke. But yes, you don't have to be a smoker to get smoker's lines. And
kissing lines, maybe.
Yeah, kissing lines, sucking out of straw lines. But yeah, those little lines that happen when you purse your lips. And you can compare that to the way a balloon looks, the knot of a balloon. If you were to let out some of the air, you get these little wrinkles that are in a bunch. It kind of looks like that. What about, we're just going to cover all the lines here on the face.
Whether those are treatable, a little bit with Botox by putting a tiny bit around the mouth.
Yeah, it's a very dicey area to do. So you can put a little bit of Botox to treat lip lines or smoker's lines, same thing. The risk is that if you use too much, then you can't purse your lips. And so you can't suck out of a straw or kiss somebody properly. And so we're very, very light-handed when it comes to treating lip lines with Botox. Although we can treat those lines very carefully with small amounts of filler. But yeah, those are treatable. Those are very difficult because we're constantly using our mouths to do things, and we're constantly working on making those lip lines. So if you're constantly making the line, it's kind of hard to battle them. But we have a number of treatments in our armamentarium to do that. But okay, what about marionette lines?
Yes, the marionette lines are the little creases that develop from the corners of your mouth and go down to the kind of lower part of your chin. And they resemble the puppets that were little marionette puppets had lines there for their little wooden jaws to move. And that's why it's called marionette.
Yeah, that's a great description of marionette lines. The other lines in your chin, sometimes it's called orange peeled chin or dimpled chin. It kind of looks more like cobblestones. Some people have very pronounced lumpy chin. And that actually is quite easily treatable with Botox, and it doesn't take very much either. So that's actually pretty popular. One thing that we kind of skip is what the term tear trough refers to. How would you define tear trough?
Well, the tear trough is sort of a hollow area underneath the eye, and it's sort of where the under eye area meets the cheek. And
yeah, I mean, it's basically the under eye area. The tear trough would be the location of eye bags, if you had eye bags. It's the location of where a lot of people lose volume. When you're a little kid, you have a fat pad there right under your eye that makes it nice and kind of smooth and full looking, and that fat pad tends to dissolve away as we get older. So we do develop a little volume loss or divot right under the eye, and that location is called the tear trough. One that I love is gummy smile. I had never heard of gummy smile before going into aesthetics about 10 years ago. And that is when you smile big and a lot of your gum is showing, the gum above your upper teeth. And that is considered less attractive. People don't like it. It makes your teeth look really big. And we actually can treat that really easily with Toxin as well. There's a little muscle that lifts up your upper lip when you smile, and you can put a little bit of Toxin in there and decrease or sometimes eliminate a gummy smile.
How about nasolabial folds? That's a real popular one to talk about.
Yeah, so nasolabial folds are the lines that extend from the the side of your nose down, just lateral, just to the side of the corner of your mouth. So it's the fold in between your nose and your lip. And we tend to get really deep nasolabial folds as we get older, especially as the skin gets more and more loose and the cheek tissue kind of hangs down. Those lines tend to get deeper and deeper as we get older. So the nasolabial folds. What about peanut head? Have you ever heard of the terminology peanut head?
I had not heard of that, although it makes sense to me. Yes.
So this came out of, I asked my staff, like, are there any terms not on my list that I should add? And one of my staff members like, peanut head, which basically refers to the look when you have hollowing at your temples. So as you get older, I keep saying that over and over, but as you get older, you get this hollowing out of the temples and you look more skeletal. And some people refer to that as peanut head. I don't love that term because it doesn't sound very good, but
it can actually be accentuated if someone, and I've seen this where sometimes patients will get cheek filler, and maybe that's the only thing that they're getting done, and it accentuates that because they have these hollow temples and then these real prominent cheeks, and so
yeah, that's definitely the case. I think that when people are doing various aesthetic treatments and their skin looks better and their cheeks look better, that's when you really notice that their temples are hollowed out, because that's one of the things that happens as we get older. It kind of gives your age away a little bit. So sometimes we'll do Sculptra for temples. I think that that's a really great tool for that. Yes, we can actually correct these things. What about turkey neck?
It's pretty self-explanatory.
I had one guy recently call it a waddle. But some people get this more than others, but as your skin thins out, it gets a little more loose and hangy. The skin underneath your chin that goes into your neck, that can like really hang down. And people call that a turkey neck. Going down my list of things here. So one is a lid lift. Can you define lid lift?
Sure. So a lot of patients come to me asking to have their brows lifted, and a lot of times they want to do it with having their forehead treated, which is funny.
Well, that doesn't work.
Which is very funny because treating the forehead muscles are the elevating muscles, so it actually doesn't really work. So really the best way to achieve a lid lift is to treat the orbicularis muscle, which is the muscle around the eye that scrunches in. And so if you put a little bit of toxin in that muscle, you can get a little bit of elevation. And also you can get slight elevation from above by being careful by how you place the treatment in the forehead as well.
Right. So if you treat the muscle that pulls the eyebrow down, then the muscle above the eyebrow, the frontalis that pulls the eyebrow up, will be able to pull it up more. Okay, so that's basically how that works, and that's a lid lift. Compare that to a lip flip. What's a lip flip?
The lip flip is putting a tiny bit of toxin into just a tiny bit, and just along the red part of your lip, so just above the red part of your lip, into the muscle there. And what it does is it affects your ability to purse your lips, but it flips the lip out a little bit, everts the lip, so that when you smile or express, a little bit more of your lip shows. So a lot of people who are considering filler maybe, or they want their upper lip to just be a little bit fuller, will give this a try.
Yeah, and that does not take a lot of toxin either. So you can achieve, it just reveals a little more lip at baseline, meaning when you're not smiling or not talking, it actually will flip the lip just a tiny bit so you see a little more lip. So that's kind of a cool trick to do. What about the term frozen? I'm going to speak to this a little bit because a lot of people come in for, either toxin or filler, or other things, and they say, well, whatever happens, I don't want to look frozen. And I think that's really interesting because it's like there are different reasons why people look frozen. And I think it'd be really helpful to clarify that. So I think, so first of all, toxin, Botox and the other toxins will paralyze certain muscles. So for sure, if you were to spread toxin kind of everywhere, your face would be frozen. You wouldn't be able to move it. Okay. And of course that's really not our goal, right? So the places we do it all the time, the 11s, the forehead, and the crow's feet, you're able to do that without making people look frozen, because the vast majority of facial expression is basically from the eyes down. So if you can't make the mean, angry face, you won't be able to make that face for sure. But people will also think that you're more relaxed and happy. Okay, but you don't really look frozen, right? You just don't look mad. And I actually think that most of the frozen look that people have is from filler, where they put way too much filler in, and the filler is, it doesn't move. So filler is a gel, right? But mostly it just takes up space and it doesn't move, which is also why I like flexible fillers. We have a few flexible fillers in both of our places where it does move with the rest of your skin. But I actually think that having way too much filler in your face is more commonly causing people to look frozen than Botox. What do you think?
I think that's true, and I think it's also the amount that you're using. So I think we try to find sort of the sweet spot where, the lightest amount that will give you the most, the best duration and sort of the effect that you want. So if you want a little bit more movement, we use a little bit less. If you want a little less movement or more frozen muscles, then we use a little bit more. So a lot of times people don't want to be frozen, but they also don't want their forehead to move at all. So,
right. Well, that's a delicate balance, right? If you don't want your forehead lines, then don't move your forehead. Right.
Yeah, but I think we can really achieve a natural look.
Yeah, for sure. For sure. A lot of people are worried about getting a Spock as a result of Botox. So can you explain what a Spock is and why it happens?
Absolutely. So, well, I think most people know, maybe not the younger generation, who Dr. Spock is, or Mr. Spock. It's Mr. Spock.
It's Mr. Spock, yes, from Star Trek.
Yeah.
So for our audience members who might be millennials and never streamed Star Trek when they were younger, we know the Gen Z people have streamed everything, so they probably know who Mr. Spock is. But anyway, he was a Vulcan character who had an eyebrow that went way up on the side and looked kind of, interesting, right?
Angry.
But so how does a Spock happen if there's a issue with toxin?
Sure. So when we treat the forehead, one of the things that we are very aware of is that we don't want to put the toxin too low so that your eyebrows can feel heavy, or that and a lot of people want to retain a little bit of movement. So what we try to do is leave the sort of the area of the lateral brow, kind of as it heads up towards the almost sort of your temple area. Leave that area with a little less toxin so you preserve some movement and don't feel heavy. But it's a fine balance of treating that area. And sometimes if you stay too high, which can happen to anybody who's injecting toxin, you'll have not very much movement in the middle of the brow, but this lateral part is the only part that's still moving. And then sometimes if it's real an extreme example, or that there's too much movement left, it looks funny, like you're Mr. Spock.
Yeah. So basically, some people have very strong forehead muscles, and other people have less strong. And how strong it is out to the side is very variable. And if they have a strong muscle there and you don't put enough toxin in there, then it will continue to have this resting tension and elevate the eyebrow. And when the rest of the middle part is treated completely. So you can't move the middle, but your resting tension laterally out to the side is too much. And so the eyebrow goes up. And sometimes quite a bit, kind of depends on how strong that muscle is, right?
Right.
So we're very careful, and we can evaluate that area. And once you get used to doing this after injecting for a long time, you kind of know, oh, this person's going to need a little more there because their muscle's really strong. But it can basically happen to anybody. And the important thing to know as a consumer is that a Spock is totally treatable. All that means is you got a strong muscle out there, and you just need a tiny bit more out to the side.
Right.
That contrasts with a droopy lid or droopy brow, and that's the opposite problem.
Right.
So those are two different things, right? A droopy eyebrow or a droopy eyelid, and those can both happen. There's a complication of toxin.
Right.
So do you want to
Yes.
explain what the difference is and what we do about it?
Sure. Well, I mean, part of the reason that people end up sometimes having spocking is because the injector is being cautious about not dropping the brow and leaving too much movement. So the reverse of this is if the forehead treatment is a little too low on the forehead, it can cause the brow to actually droop, and it can actually patients can feel like their lid is drooping, but it may actually not be the lid. It might just be that the brow is heavy. And as we age, that's one of the problems that we develop, is that our whole forehead skin becomes more lax. Our brows are dropping, and so we raise up our brows, which creates all these forehead lines. But if you treat the forehead lines, then the brows drop back down, and it becomes this impossible situation. And so some patients really can't get forehead toxin because of the brow dropping.
Yeah. So some people, as we get older and the skin is looser, we're constantly raising our eyebrows up using that frontalis muscle to keep our eyes open, because our skin gets looser and everything's drooping a little bit. And so for people like that, you have to be really careful. You may not be able to have any toxin at all on your forehead. And you have those deep forehead lines because you're trying to keep your eyes open. Toxin is not a good treatment for those people. And they are the ones who tend to get a droopy eyebrow if you put too much in, because their skin is already a little droopy. Right. It's really kind of rare to get that in someone younger who doesn't have that. And all of that is really about the droopy eyebrow, not the lid. So the eyelid, the way you flutter your eyes, the way you blink, there's a little muscle inside your eyelid called the levator palpebrae. It's a teeny, tiny little muscle. And that muscle's not anywhere near where we're injecting. And for the most part, where we're injecting for facial lines, the toxin should not have access to that muscle. But it can get in there by accident. The most obvious time I've ever seen it was when somebody had an allergy. This was way back when I was testing out Xeomin, and she had an allergy to Botox, and we knew that. And because Xeomin has less protein in it, I was like, well, let's try this. And if you react to that, then we're just never going to inject you ever again. Anyway, she kind of swelled up, and because of that swelling, it got access to her eyelid, and her eyelid was droopy. And the only thing about that, so that's a drag. It kind of looks like you've had a stroke. It's terrible. And the only good thing about it is that there are eye drops that actually do really well to treat that, and you can use eye drops until the lid lag goes away. And but those two things are very, very different things. Having a droopy eyebrow is a little more common than having an actual eyelid droop. What are some other terms that relate to Botox that we wanted to cover? I think we still haven't covered necklines and platysmal bands. Do you treat necklines with Botox, and what do you call those lines?
They're treatable with Botox would be the lines that are called platysmal bands. And the platysma is this really broad, thin muscle that runs all the way across your neck from your jawline all the way down to your collarbone, basically. And it's this thin muscle. And then what you'll notice in some individuals that people will start to have these little bands that stick out, and they run from their jaw down to their clavicle, up and down direction.
Yeah, it's hard to even describe verbally what platysmal bands look like. And when I'm talking to a patient who really hates them, they can recreate them. They're like, "Oh my God, look at my neck!" And when you do kind of like a
weightlifting face or something.
Oh yeah, like a weightlifting face. Like if you're a face where you're like lifting a big heavy barbell, you get these vertical lines, and those are actually quite easy to treat. Super easy. It doesn't actually take nearly as much toxin as people think. 15 or 20 units oftentimes is plenty. I do think that it's over-treated out there. I had one patient who went to the East Coast and someone put like 60 units of Botox in her neck and she could like barely swallow after that. But that's not necessary. It's actually easy to treat. I think there are many people who will treat the horizontal lines of the neck, and some people will call that Cleopatra.
TD lift, treating along the...
Yeah, Nefertiti lift. I've never found that to be particularly effective, but in my opinion, so we've played around with this, microtox and various toxin treatments for the horizontal lines. I think there are way better treatments for that. I think that toxin doesn't do a great job, but you can do it. It's not particularly effective. It works way better in the muscle for platysmal bands than it does for any of the horizontal lines. So we have better treatments for the horizontal neck lines. Okay, I wanted to ask you one more thing. What are some of the terminology around TMJ and teeth grinding and masseter treatments? I know that we both treat those things. Do you want to define some of those terms for our audience?
Sure. Well, the masseters are a muscle that are a big part of all of those things you just mentioned. They're the big muscles kind of at the lateral corner of your jaw. And in some people, they're real prominent. They can make your face look a lot more square. And they're muscles of mastication or chewing muscles. But a lot of people, while they sleep, they grind their teeth, or they clench their teeth, or they... And they have a lot of pain and headaches and
yeah, it can really damage your teeth. I've had plenty of patients who grind so much that they've broken teeth and needed implants. And a lot of times people will wake up with headaches or jaw pain. And so when people talk about having quote unquote TMJ, TMJ actually stands for the temporomandibular joint. It's actually the joint between your head and the jaw. It's where your jaw attaches. And grinding can actually cause pain in that joint as well. And you have a little teeny disc in that joint that can get damaged or out of place. And so it can really be problematic and actually quite expensive to treat, especially if you need a dental implant. Those are super expensive. So all of that is treatable with toxin. It's actually really easy to treat the masseters. It's such a giant muscle compared to all the muscles we aim at. So it's kind of hard to miss, really.
Right.
So I had one more thing. What about hyperhidrosis? What is that, and where does that happen?
Hyperhidrosis is it's a fancy word for excessive sweating. And that can happen anywhere in the body, but underarms are super, super common. People get it in the palms of their hands. I've even had patients who had scalp hyperhidrosis that had treatment in their scalp. And Botox or toxin in general can reduce that significantly, and it's quite impressive, really. So it's a great treatment.
Yeah, I've treated all of those areas: armpits, palms, and hairline, mostly hairline. Mm-hmm. I haven't done the whole scalp ever, but I've had a couple patients who have really a lot of sweating at the hairline. And it's remarkable how well Toxin treats that. It just makes it go away. And it actually lasts longer than it does for wrinkles.
Absolutely.
How long have you seen it last? I feel like I've seen it anywhere from 8 to 12 months.
Right in that range.
Yeah. It's pretty cool. Sometimes I've had patients kind of forget that they did it, like they treated it once and the sweating went away, and when it started to come back, they were like, "What the heck is this?" And then it came back full on. Usually when it's coming back, it takes about a week or two to really come back. So when that starts, it's like, "Wait a minute, am I sick?" And like, "Oh no, this thing's starting again." But yeah, so. Is there any other terminology related to Botox? I think we're going to have to do a whole other episode on the rest of the terminology because we've taken up all our time talking about wrinkles and toxin terminology. Any other terms to bring up?
I can't think of any at this moment.
I think we've covered it all. We've covered a lot. Well, Des, thank you so much for being with me today. Will you come back and we can talk about all the terminology as it relates to all the other things we do?
Of course, I'd love to. This is
awesome.
All right.
Thank you so much. We'll see you again soon for that second half.
Sounds great. Take care.
If you have a question or a crazy story of your own that you'd like to hear on Medspa Mayhem, contact us through our website, medspamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Medspa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspamayhem.com. We hope we've taken some of the mystery out of the Medspa jargon for you. Check here next week, and we will get into the unusual terms used to talk about fillers, skincare, and many aesthetic treatments like cool sculpting and lasers. Links to more information on all these terms can be found in the show notes. This has been Medspa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Medspa Mayhem comes out June 2024. Available everywhere books are sold. You can pre-order now on Amazon, Barnes & Noble, and at bookshop.org. Links and more can be found on medspamayhem.com.